All right. So good evening, Southcoast. Everyone watching from Bedford and Fall River and out the Southcoast area. Hope everyone's doing well out there. I have a special guest. We're continuing our Southcoast Health conversation weekly with one of the doctors there. And today we have Dr. Matthew Phillips. He's the Neurosurgeon and Chief of Southcoast Brain and Spine Center. So how you doing over there, Dr. Phillips?
Doing great. Beautiful summer day. Long summer.
So you're joining me, and you said you just got out of surgery, or?
Just got out of surgery. Wednesday is one of my surgery days. Used the great 7D technology. So the usual, it's about, typically get out of work. So normal day.
So just tell people, because obviously you're obviously one of the senior doctors over there, but just tell people a little bit about yourself, your background, how you got into medicine, and what you do now at Southcoast.
So I was born here in New Bedford. I was born at St. Luke's Hospital. My father, Lee Phillips, was an oral surgeon in town. And I left for college, medical school, and residency. And I was sort of on this track to be an academic neurosurgeon, be a professor, and joined one of the Ivy League universities to be a professor there. And I had this sort of epiphany as to what did I really want out of life. And it sounds a little corny, but I wanted to just take care of patients and do good surgery. And when I thought about where I wanted to do that and the people I wanted to take care of, then became obvious to come back home. And in 2000, I came back here and opened up a small office on Brigham Street with the secretary, with the help of Southcoast. They saw the potential, and they definitely saw the need for neurosurgical services here, which were a lot of which was not staying in the area. And we started out with really in the front of an electrical repair shop. And between the help of Southcoast and great patients and a lot of hard work and unbelievable support from the staff in the hospital, we now have 3 multi-specialty outpatient centers at 3 hospitals, with 3 inpatient centers where we have neurology, neurosurgery, pain management, we have neuropsychology, we have physiatry, all the specialties that revolve around healthy brain and spine.
Yeah, so anyone watching out there, we're already getting comments. If you have a question or a comment for Dr. Phillips, throw it in there. Just know, obviously, he can only give so much information without seeing you. So just ask questions and we'll throw it out there. So I'm curious, because you come from a line of surgeons. So just tell me a little bit about your dad. What did he do before? Is that kind of what got you inspired to be a doctor?
I don't know. I'm not sure. It's been so long. I don't think I can remember. I know I get to park wherever I want, whenever I want. That's sort of cool. No, my grandfather emigrated to the United States and worked his way through medical school in New York City. My father was interested in medicine and was a medic and a surgical scrub tech in World War II. And then decided to go to dental school and ended up here in New Bedford. There's no doubt that my parents always believed that it was the highest calling. I mean, think of that, being in the service of others, being to preserve life with your own hands. I'm not sure other than maybe raising children, I'm not sure there's a greater calling in life. And I think that certainly when I went to college as an art major, I didn't really think that I was going to go into medicine. But one thing led to another. I got an experience with a neurosurgeon out in Utah as a college student and said, wow, the brain's really cool. And here I am.
So we're getting a lot of comments. You get a lot of patients out there. So I'll give a couple because it's good. It's good to see feedback from your patients, right? So Melissa Perez says, that's my back doctor. So good. So Cindy, here's someone that Cindy just put out there. Water was found in my brain. What can be done? I don't know if you can answer that or not, but
sure. I mean, there's a variety. there's a variety of different things, obviously, which can happen to the brain and the spine, and oftentimes they're connected. People could have brain problems that end up being spine problems, and vice versa. And water on the brain, call it hydrocephalus. Hydro meaning water, cephalus or cephalus meaning head, and water on the head can occur for a variety of different reasons. You can be born with the problem, and children need it treated early. You can develop it later on in life. You can get it after trauma. And there's a very specific type of water on the brain people can develop when they're in their 70s and 80s that also requires treatment. It's actually one of the easiest things we know how to take care of, because it's simply plumbing. We make water every day, much like you make saliva. You make saliva every day, you swallow it, the water goes into your stomach, the water gets absorbed, you make more saliva. It's the same thing in the brain. You make this brain fluid, spine fluid is all connected. You make this brain fluid, you absorb the same amount that you make. But if for some reason that flow of fluid is blocked, or you're making too much fluid, it becomes a plumbing problem. And we simply treat that, believe it or not, by diverting the fluid away. We actually put a very specialized tube. I know this sounds crazy, but we put it into the brain, run it under the skin, and drain it into your belly. We actually did one today, believe it or not. The operation takes sometimes a half hour, 45 minutes, maybe an hour. The complications are almost non-existent, and you can see remarkable recoveries and improvements from it.
Okay, so Iris Rivera says he did my surgery on my husband's neck. Amazing doctor. Josh says, thank you, Dr. Phillips. Isabella said he's my doctor and he's the best. I can walk because of him. I mean, that's pretty significant, right?
I'm telling you, these I have the greatest patients on earth. They are so patient, and I'm a little bit of a quirky dude, and they're so appreciative of that. I can't. There's no other group of people I would ever, or community I would ever have the ability to treat and be as accepted.
Yeah, Joanne has a long one. She says, Dr. Phillips, you operated on my back that I had pain for nearly 20 years. I have not had pain since he operated. He is my angel. I did not realize he was Dr. Lee Phillips' son. As a 16-year-old, I worked for Dr. George Riley. He was my for many years. Barbara says, amazing doctor. You got another one, great doctor, did my back and neck surgery. So this is basically, you got a lot of fans. I think I should get you to sign autographs later on.
Apparently some of these people have my autograph.
We'll go back to some more of them, but you got to go back and read. There's another 5 or 6 in there. So here's the thing, and I'm going to pull up a photo while you talk, but so you did the 200-7D, which 7-dimensional achievement. What, if you can explain that, why is that? I mean, we all think in 3D, right? Most humans. What is 7D?
So 7D is a catchy name, but it actually really points out what the amazing stuff that this machine does. So technology has gotten better, and here at the Brain Spine Center, particularly neurosurgery, we've always been big fans of technology. Dr. Markovici, Dr. Harrison, and myself, and now with the addition of Dr. Weil, we've always been big fans of new technology, new and useful and good technology that's been vetted. I'll give you an example. Dr. Markovici was the very first doctor in America to put the artificial lumbar disc in when it became FDA approved. And the importance of bringing new technology into a health system to better the care of the patients has never been, the administration and the staff at Southcoast have never shied away from that. They've always opened their arms to that concept. And really, every time they have, it's worked in everyone's favor, particularly those of the patients. 7D, the big term being thrown around right now is robot, right? The robot does this, the robot does that. When we talk about spine surgery, we talk about technology and the robot in spine surgery. We actually talk about navigation, and the robot, it becomes secondary. So navigation is the ability, and you can see it on that picture there, where you have an instrument. And the instrument that you're actually working on the spine and the brain, we use this for the brain as well. while we're working on the brain, while we're working on the spine, the instrument shows us the entire anatomy of the spine and brain, because you can't see it. You're working through a hole. You're working in an incision, which sometimes is only this big. So you don't see what's in front of your tool. You don't see what's on the side of your tool. You don't see what's above and below your tool. But this technology allows us to see the entire brain or spine and all the structures around it while we're working, to be able to avoid critical structures, or more importantly, get to critical structures in the least and most minimally invasive way, and in the safest way. And 7D is the, in my opinion, is the most technologically advanced system that allows for this. And so people go, okay, where does the robot come in? Well, all the robots that are out there, and they're in spine, this is not the robots with respect to prostate surgery or knee surgery, but with respect to spine is, and if there are robot people out there, forgive me for being presumptuous, and I apologize, but there's a reason we don't have the robot, and that's because the special sauce of the robot is the navigation, showing you where the arms and where the tools should go. Once the navigation shows you where to go, you then put the tool or the screw, if you're going to put it in the spine, into the robot arm, and the robot arm then puts it in for you. When I looked at the robots, I didn't need a mechanical arm. Once the navigation showed me where to go and where to put the screws in, I didn't need a mechanical arm, $1 million mechanical arm to put it there. I just need the navigation piece of it. The other cool thing about 7D navigation, it requires no radiation whatsoever, where most of the other navigation systems require radiation in the operating room to register. But more importantly, because it doesn't require updated x-rays and or MRIs or CT scans in the operating room, you can re-register this in a second. And it's the only system that responds to changes in the anatomy real time. So if you're doing a spine case and you've got to move one bone on the other bone, this can register to that movement, and you're navigating once again to exactly where you have to go. Many of the other systems, including some of the robot systems, don't have that ability. This will be the only system that will allow for what we call brain shift. When you open the skull and you have the brain shifts, right? It's floating in water. You drain the water off. No other navigation system allows you to accommodate for brain shift. This one will. It's really cool, neat stuff. And I love the fact that we have literally the most technologically advanced surgery in the world. We were the 11th people in the world to get this. It's just so cool.
Yeah, I was reading in 2019, Southcoast became the first healthcare organization in Massachusetts to adopt this technology. So it kind of shows that the hospital group actually invests, because like it sounds like to me, you're gonna have safety, it's gonna be faster, no radiation. So just so many benefits of something like this.
It's unbelievable. And we have some older navigation systems that we sort of used, and they had their idiosyncrasies. And when some of the newer navigations, and I'll say some are intraoperative CT scanners, intraoperative MRI scanners, intraoperative, as we talked about the robot, there are all these, and I would present these things to the Southcoast administration, go, look, I think we got to look at these. And they said, sure, absolutely. We want to provide our patients with the safest and the best technology. And we looked at these other technologies, and the reason why we don't have an intraoperative MRI, the reason why we don't have an intraoperative CT scan is because when the neurosurgeons looked at them, we said, this doesn't make it safer or better in our opinion. Obviously, there are physicians who use it and use it very well and very successfully and very safely. And when this came out, we looked at it and we said, this is technology. This is going to do things we could never do before.
Yeah, so I'll take a few more comments. So Don asked, will aneurysm coiling be possible in the Southcoast area?
At this point, we don't have plans to do that. And the fundamental reason for that is to be a really good center for aneurysm coiling or clipping. I used to clip aneurysms here, believe it or not. Is you have to do a lot of them. And our population isn't quite big enough to get enough patients where we can actually do a lot of them and really be as good as people who do more of them, such as the academic centers. So At this point, we don't have a plan to coil aneurysms, but that's a great question, and something we actually revisit every several years and look at our numbers and say, is this something we should invest in? And we, to this point, we decided not to. We want to be a great center. We want to be the best center, and for what we do, we are the best center. We don't want to take on things where we're not going to be the best center.
So Mary says she was told she has edema of the spine and curvature. I think he said, and the hardware is loose. I see my neurosurgeon at 28th, but I'm scared and I've been so much pain. So I don't know how much advice you can give to her.
Well, Mary, that's unfortunately we see this a lot. We see, not necessarily from our patients, but unfortunately one of the complications of this type of surgery is you can get loosening of the hardware, and it can depend on a bunch of different factors, sometimes even bone osteoporosis and bone biology. My specialty is for example, I do a lot of revision spine work. So patients go elsewhere and they have a problem with their surgery like yourselves. I will fix other spine surgeons' problems. This is something we do a lot of here. We see a lot of patients who've gone elsewhere and like yourself have had some issues, and we specialize in this. We do this every week.
Yeah, Denise says she just changed to you for a neurosurgeon, waiting to meet you.
And Denise is putting the pressure on me.
Yeah. Keisha says he's excellent, my doctor for 5 years. Hi, doctor. You operated on my ruptured disc in my lower back. It was in early 2000s. You look good. Hope you're doing well. Take care. That's Nancy Costa. Barbara says I wouldn't see anyone else.
Barbara's very kind.
Tommy says I couldn't even walk before I met Dr. Phillips. After he operated, I had no pain and had full mobility. He's the best. Cindy says, thank you. Would it be okay to make an appointment with you? There is so much more to say. So yeah, I think you got to call your doctor, get a referral, or you got to switch over to Southcoast if you're not in it.
I don't know how that necessarily works. If you're not necessarily in the network because you're a patient out of network, it doesn't mean we don't necessarily take your insurance. In fact, we take most insurances, if not all, generally in the area. And so sometimes if patients just call up the office, our staff will help them figure that out and help them navigate that somewhat complex world of insurances.
Virginia says, great doctor, operated on my husband and sister. Ruth says you're her hero.
Oh, Ruth.
Let's see. Robert says Dr. Phillips is the best, great guy.
So
that's all the comments there. But I want to ask you something. So because it's the one thing we have in common, obviously you're a doctor. I was in the military station in Hawaii and I came back to New Bedford. You lived in New Bedford, went off, obviously became a neurosurgeon doctor, and you came back to New Bedford. So why did you come back and choose Southcoast as your home again?
Because I lived all over the place. And I met all kinds of people, great people, fantastic people. It's actually the best place on earth to live. And it's very simple. The reason why, number one, the people here are just fantastic. We have this wonderful melange of cultures and peoples, and we have a very diverse group of people that we all share the same culture. We're different ethnicities, we're different religions, but we share the same culture, this sort of Southern New England culture that I'm not sure I could necessarily give specifics other than maybe coffee, milk, and saying words like wicked. But that culture really binds us together, and I didn't realize that until I left here, and I never felt home anywhere else I ever lived, and I couldn't quite figure out what it was. And every time I'd come home, I would say there's something special about this place. And then you start living other places, and we don't have crime that other places have. People are generally nice, not necessarily friendly. We are New Englanders, but they're nice. They're cordial. The topography is just fantastic. The most beautiful ocean, particularly today. It's probably the most beautiful place in the world. And I think the most important thing in part of New England culture is that we don't, how do I say this? We're not flashy, showy people generally. We're not necessarily interested in what club you belong to or what car you drive, or people are generally interested in one another for the quality of who they are. And when I lived in places where that was not the case, it was not where I wanted to be. And then when you think about taking care of people, when you start taking care of patients, you want to take care of patients that are like yourself.
Yeah, in the military, I lived in or visited 22 countries, and I tell people you still kind of like have a longing for the food and culture of the South Coast, New Bedford area. So let me ask a few more questions. We'll take comments. So I think the biggest misconception is that you have to go to Boston or Providence to get good health care. So why is that wrong?
It's not necessarily wrong. I have some fantastic colleagues in Boston and Providence that I myself would go to for certain things. Think about this. If you're not in medicine, you're not a physician. You've never studied disease, and disease is very scary, and there's a lot of anxiety associated with that. And you get sick, or your child, God forbid, gets sick, or your family member, your friend, your parent, whatever, they get sick. We've all been through it to some degree. You want, quote unquote, the best, and you just make the assumption that the Ivy League, we're 50 miles south of Massachusetts General Hospital. We're 35 miles east of Brown University. We think that those places are the best. And then I say to some of my patients, they'll say that to me, why should I stay here and have my lumbar spine operation with you? Why don't I go to the best in Boston? And I'll say to them, what do you do? They say, I'm an electrician. Like, oh, what do you specialize in? Oh, I predominantly do, industrial stuff. I go, really? I go, do you know any electricians in Boston? I go, oh, yeah. I go, are they better than you? Do they do a better job than you? Right? I mean, there may be several ways to put up a wire, but there's really only one series of ways to put up a wire that makes it safe. When you open up a spine and you put screws in the spine, whether you do it in Boston or you do it in London or you do it in Tel Aviv or you do it in New Bedford, there's really a small window of doing it right and doing it safely. And why wouldn't, if we have the technology, why wouldn't we do it as well here? Why would we deliberately do it worse? And what I tell to patients is, I went to one of the top medical schools in the country, and then I trained at one of the best neurosurgical programs probably in the world. Why would I come to New Bedford and then practice second-rate neurosurgery? I came to New Bedford and I brought the world's best neurosurgery here. Now, I don't do everything, and the coiling of aneurysms was a good example. There's some things we can't do because we don't have either the numbers of patients or the technology, or have decided not to buy the technology. Not that we can't get it. And so, for what we do here, why not go to Boston or Providence? Because for what we do here, I fundamentally believe we do it better. And we don't do it better because I'm a better surgeon. We don't do it better because I have a better screwdriver than they have in Boston or Providence. We do it better because the nurses here, the support staff here, the ORAs, the anesthetists, so many of them were born and raised in St. Louis. Mm-hmm. And I'm never more than one person removed from every single patient. We get to talking, oh, I know them, oh, you know them. And all of a sudden you're taking care of your neighbor, you're taking care of your friend, you're taking care of your friend's friends. It puts a whole different level of care and concern for the patient that you don't get when you're in a bigger hospital. And I think that fundamentally can change care and make it fundamentally better.
All right, I'll take some comments and we'll close up. So Jackie says, are you taking new patients right now? She's seeing someone from Angels in Taunton, but would definitely like to see someone closer to home.
You take new patients every day, anytime.
Jeff says, "Saved my life this past fall." Pun intended. Thank you, sir.
Jeff.
Jackie says, "I've had an aneurysm territory tumor gamma knife treatment. Also,
and we do see patients with, even though we're not treating aneurysms, there are a lot of patients who don't necessarily need aneurysm surgery. So we see them and we talk to them about their disease, and we talk to them about options, and we talk to them about, pituitary tumors. We actually are fortunate to have one of the nation's best pituitary surgeons here at Southcoast. He just joined us, Dr. Weil. We trained together at UPenn, and he was actually at the Cleveland Clinic for many years and has probably done more pituitary tumors than almost anyone else in New England. So we have a pituitary tumor expert.
Katrina says, "Could 7D help those with refractory epilepsy that are considering exploratory surgery?"
Actually, Katrina, that's a great question, because we are upgrading our 7D system to include the brain over the next several months. And both Dr. Weil and myself, we actually did special training in epilepsy surgery. I actually had the only community epilepsy surgery program in New England for many years. So yes, when 7D does actually, when we do upgrade the current navigation system to include the cranial package, yes.
Beverly Madera says, "Thanks for being my doctor."
Thank you for being my patient, Bev.
Jackie says, "I get horrible dizzy spells, had passing out problems also, cannot find the problem." That's going to be something you probably want to talk to your doctor or contact Dr. Phillips' office. So Kathy says, 7 back surgeries in total for Dr. Phillips. Did the last 4. I know need another one. This is a long one here. Let's see. Just a basic comment there. Dr. Phillips is a good surgeon. How come nobody does Tarlov cysts?
Tarlov cysts, Kathy, you are talking about one of my favorite discussions I have with patients, because Tarlov cysts is a very common finding in MRIs. Tarlov cysts are these outpouchings of spinal fluid from the sac of spinal fluid that generally don't cause any pain or other symptoms. And when you operate on Tarlov cysts, in the past, when we first started finding them on MRI and different studies, a little before my time, they decided to try to operate on them, and they're fraught with terrible complications, and it doesn't help them. And most importantly, Tarlov cysts themselves are generally benign and generally don't cause problems.
Okay, so last one here. You can't pay me to go to Boston to see a doctor. Dr. Phillips has done my C5, C6, and C7. I'm not in a wheelchair because of him. So a lot of accolades there, a lot of happy patients. I think we had about 40 comments or so. So really good. So we appreciate your time, and we like doing this every week to let people kind of have a chance to talk to their local doctor at Southcoast Hospital. Really great. Listed in Newsweek as one of the top hospitals year after year. I think you guys just hit your 25th anniversary being in the South Coast. Been here a long time. It's a non-for-profit, hospital, and it's really a great place to be. So I'll let you kind of close off with a quick goodbye, I guess.
Well, I just want to thank everyone for allowing me to talk about what I love. I can't, and I've said this before, I could never in a million years have dreamed of having such a privilege as to be able to care for so many great people and be an integral part of their lives. And I feel blessed. I feel that I've been blessed by heaven to be able to do this, and I'm going to keep doing it as long as I can. So.
Yeah, and I guess I got to do these last 2 comments. I guess Jamie, maybe, "Hi, Madman, miss you." And this is the last comment. I think this is what we've heard over and over. "This man saved me," Tracy Stores.
Yep.
So I think you obviously have to take these comments and really appreciate the work you do. I mean, people really appreciate the work you do. So it kind of gets me kind of like, people, they need to see this kind of stuff, because we have fabulous doctors at Southcoast Health, and people need to see this stuff. It's just amazing. They keep coming in, so you have to keep checking the comments. Diane says, "Save my husband." Thank you. So it's good. It's really appreciate your time. It's good to see people need to see this kind of stuff because the work you're doing is what they say is God's work, and it's really good. Because I've been lucky not to have back problems, but I know people that had brain tumors, and my brother has back problems, and without the medicine that's out there now, people would just be in miserable pain their whole life or have died at an early age. So,
yeah. I think the biggest thing is not necessarily, and we talk about technology because it's flashy and it's showy and what we can do, but the best care you can provide a patient, and I've always believed this, is, and I'll make this quick because I'm sure you have better things to do than listen to me rant, but talking to the patient, having the patient truly understand their problem and being invested and engaged in the patient's problem. I'm telling you, that alone is so therapeutic. I've seen patients with a lot of terminal disease, and those patients that understand their disease, that know what to face in their disease and what each day is going to what's going to happen each day, and to anticipate that gives them control. And when you have control over your disease knowledge, when you have knowledge, you have control. When you have control, you don't have fear. And when you don't have fear, you're not miserable. And it's the physicians. It's one of the physicians' most important roles is to help the patients understand that.
All right, so we had a chance to talk to Dr. Matthew Phillips. He's the Neurosurgeon and Chief of Southcoast Brain Spine Center. So I really appreciate your time, Doctor. A lot of people out there learned a lot, and we look forward to talking to you again maybe sometime soon in the future.
Thank you. Thank you very much for doing this. I appreciate it. Thank you.